Hi, today we'll be talking about Creutzfeldt-Jakob disease, or for short, CJD. CJD is a rare, rapidly progressive, which means it gets worse over time, neurodegenerative disease affecting the nervous system. CJD belongs to a group of diseases called the prion diseases. These group of diseases are caused by a protein found in the neuron, which is called the prion protein. CJD leads to dementia and various neurological symptoms. Normally, neurons contain these protein prions and they function normally, but in this disease, these prions acquire mutations that cause them to be misfolded. What are the causes of this mutation arising? They can be sporadic, which is the most common case, arising spontaneously, and also familial or acquired, which are less common. The misfolded prion will act as an infectious agent. How? It will interact with normal functioning prions and cause them to become misfolded. And when these become misfolded, they will cause other normal prions to become misfolded, forming a self-propagating cycle of protein misfolding. As this goes on, the misfolded prions disrupt normal cellular processes of the neuron by accumulating within the neuron, and this can cause neuronal dysfunction and death. And this process propagates very fast, causing death of the neurons very rapidly. That's why it is a rapidly progressive neurodegenerative disease. Once the disease progresses, there will be clinical features. What are the clinical features of CJD? First, rapidly progressive dementia. This is important to distinguish between Alzheimer's disease and CJD, where Alzheimer's disease progresses slowly, while in CJD, rapidly progressive dementia occurs. Second, myoclonus, which means sudden, brief, involuntary muscle jerks. This happens because the abnormal prions also accumulate within the motor neurons controlling the muscles, affecting them and causing the death of the motor neurons, and that's why this symptom occurs. Also, it causes ataxia, which is the loss of coordination. The patient will have a hard time walking, and if they try to walk, they will fall down. This happens due to the disease affecting the cerebellum also. How can we diagnose Creutzfeldt-Jakob disease? First, histopathology. When we take a specimen from the patient's brain, either a biopsy or an autopsy is basically a biopsy but after the patient has died, we can see the histopathology has gone through a spongiform change. This is caused by the death of neurons. Second, it is the CSF fluid or the cerebrospinal fluid. We tested for the 14-3-3 protein, which marks neuronal cell death. If this test is positive, we know that there is a disease affecting the neurons causing their death. Or, most specific for this disease is real-time quaking-induced conversion, where we mix a patient's sample of CSF, which contains the abnormal prion proteins, mixing them with normal prion proteins, and quaking it, means shaking it, to see if the abnormal prion proteins cause the normal prion proteins to become abnormal. When that happens, we know that this patient's CSF fluid contains abnormal prion proteins, which tells us that this patient has Creutzfeldt-Jakob disease. Third, we can do EEG for this patient, or electroencephalogram, which if we see periodic sharp wave complexes, we can say that this patient has Creutzfeldt-Jakob disease. But not every patient has periodic sharp wave complexes within their EEG. The most common used tests for patients who are suspected of Creutzfeldt-Jakob disease are the CSF fluid test, 14-3-3 protein, and real-time quaking-induced conversion. Also, sadly, there is no cure or treatment for this disease. The patient deteriorates very rapidly over the course of months and dies because of the loss of control of essential and vital functions of the body, such as breathing or the cardiac heart rate. Thank you for watching this video. I would be appreciative if you subscribed and liked the video.